Hey guys, welcome back to my channel, and today we have Daktari back again, and we have a very interesting topic. But first, I'll let her say hi to you guys. And before she says hi, thank you very much for going to her clinic and also for women embracing their reproductive health. They've been going and getting answers and also having their issues sorted. Like we said, Google, but also seek professional help. So kudos, ladies.
Hi everyone, for those who don't know me, I'm Dr. Christina Sule. I'm a consultant obstetrician and gynecologist at my private practice called Alora Medical Practice, and I'm so glad to be here today.
I don't know how to say
obstetrician.
Gynecologist, obstetrician. I usually have a hard time with that, so it's easier for me to just call her Daktari or Doctari, like we always make jokes. We always make jokes. So today our topic is about two topics. We'll start with intimate skin lightening, or intimate, that's what it's called, intimate skin lightening, and also vaginal Botox. But first we'll go with the intimate skin lightening, guys. And before you panic, ladies, I don't know, gentlemen also, I don't know, down there gets dark, but it's something when Daktari mentioned to me, I didn't know that there's a solution. She mentioned to me, and you know how adventurous I am. So this was not about just adventure and curiosity. It's actually something that I also have a lot of, like in between my legs and around that area. It's way darker than my other parts of my body. Fine, it wasn't like giving me sleepless nights, but it's something, if there's a solution for me personally, I'll run for it. So I'm actually a patient here waiting to go through it. Yeah, so I thought Doctor, you should just tell us what are the causes of that discoloration, of that darkening, especially for women who are light-skinned or maybe who are chocolate, because when you're dark, it doesn't necessarily show. So what are the causes? Why is it like that? And most women tend to be a bit darker there, armpits here. Why down there? Let's start down there first.
Yeah, in general, gynaesthetics is becoming really popular globally, and you are right. Women who are very fair-skinned or very dark-skinned, it doesn't show as much. So it's a problem that affects people who we say have type 5 and 6 skin, which is what we would see as Asian and African skin, and the products that are available are also more effective for types 5 and 6 skin, which is the Asian and African skin. But some of the causes of we call it intimate hyperpigmentation, which meaning the pigment is really intense in particular areas. It could be hormonal, for example, when you're pregnant or when you age, like towards menopause, you could get darkening of the intimate areas. It could be because of a medication that you're taking. It could be because of clothing that you're wearing. So if your underwear is really tight, you could develop lines of hyperpigmentation. It could actually be from a process called depilation, which is the hair removal process.
Shaving.
So, yes, shaving, waxing, hair removal process causes an inflammatory effect, and after the inflammation, you get what is called post-inflammatory hyperpigmentation, meaning the skin starts to darken after it was inflamed for a while. So there's very many causes.
I think for mine is all that. Pregnancy,
shaving, hormones, pregnancy, sensitive skin. Yes, there are certain people who have certain what they are called phototypes of skin that are more predisposed to darkening than other people. Yes.
Okay. So what I wanted to just put it out there, that hyperpigmentation can happen anywhere in your body, under your eyes, around your mouth. I told you here, down there. So it's also part of your skin, guys. This is not a separate part of your body. So like the guy said, there are many reasons of why it could be way darker down there. Again, I said most women, they don't lose sleep over it. Why I would personally want to deal with it is because I'll be a bit more confident in terms of, you know, when I wear my costume, I go to the beach. I myself cannot wear a costume and sit on the beach with my legs like this, because the difference there is quite, the contrast is really, it's big, it can be noticed. So that is why I would deal with the hyperpigmentation, just to give me a confidence boost. And also, if there's a fix to the issue, why not, ladies? Life is short, you know. I can fix something, why not? You know. So Daktari is going to show us the latest product in the skin lightening and what is in the market nowadays, but I think this is the best of the kind. She'll explain to you. I haven't done it, I can't wait to try, but I've had very good results about it. So Dr. is going to explain the process and who is a candidate for it.
So it's difficult to tell a candidate because we can't tell who's going to have an allergic reaction or not. So, and one of the adverse effects is allergic reaction, a skin allergic reaction. Although they are very rare, they usually resolve very quickly. Most of the time they do not require any additional treatment, and they're not so severe. They don't cause too many problems. But some of the areas that do get dark are, for example, in between the thighs, the external female genitalia, the vulva, that is, the lower part of the stomach or the abdomen, the elbows, the underarms, the elbows. Yes, the area around the anus. So the intimate part,
the area around
the anus, it's called the perianal area.
Okay,
can get a lot of darkening. Some women find that it causes a bit of an issue with self-esteem for them, of course. Some women say that the lightening improves their sexual experience because now they have confidence, as you had said.
You have little to worry about.
You have little to worry about. But one of the other things that actually makes women do this a lot is because of intimate hair removal. So once the hair has been completely removed, it becomes very obvious that the skin is much darker than when the hair is actually there. So I feel like the hair removal almost leads to that. Some women do it, of course, recreationally or aesthetically. Some women do it culturally, prior to a wedding.
Oh yeah.
Yeah, so that's one of the reasons why
especially the Muslim ladies, costly, like before their weddings, they do a lot of scrubs, henna, turmeric, just then to be smooth.
Yes.
Yeah, I've seen a lot of that also.
Yeah, and so that to return the skin tone to the surrounding, the tone of the surrounding
so to
skin,
match the skin tone to match.
Exactly.
Okay.
Yeah. And so this is a product called Dermamelon Intimate. I'll show you just in a bit. It's a product that was launched in January this year. It is the top end of intimate skin lightening products. It's really good. The effects are really dramatic, really quick, has very little side effects. But the other really interesting thing about it is that it improves the quality of the skin as well in that area. So if your skin was a little bit wrinkled or had a little bit of a rash, or the pigmentation was a little bit patchy, then it improves that as well. Like the quality of the skin is noticeably better after this process. So that's a plus. You're not just lightening your skin, but you're also improving the quality of it as well.
That's music to my ears.
Before I open it, I'd like to see how it works. Okay, so the plus of this product is that not only does it cause skin lightening, but it also improves the quality of the skin. So if the skin was a little bit rough or had some extra wrinkles or had some patchy form of hyperpigmentation, there's noticeable improvement in the quality of the skin, not just the color. And that's a plus for this product. It's really top of the line in the derma aesthetic field. So it's used a lot by dermatologists or cosmetic dermatologists, but this is specifically the intimate pack, meaning that it's to be used on intimate areas, meaning the vulva, the female external genital structures, so not the lower abdomen, the perianal area. It can be used for that, but this is specifically the intimate pack. There's a slightly different pack for that one.
We better get that pack.
We will. Right. And so how this product works is basically it reduces the inflammatory factors in the skin. Remember we said that when inflammation happens, skin can darken. So it reduces the inflammation. It removes the pigment that is currently there and also stops the pigment from reaccumulating. So it's very unlikely that you're going to have the process and then before you know it, you're dark again. Although I'll explain what you need to do at home to be able to maintain that process. But it prevents hyperpigmentation of the skin, which is a really important thing.
Yes, or going back to originally how you are. You can be a little bit darker because it happens, but you can't go back to zero.
Yes, for sure.
I also like the fact that it improves the quality of your skin as you're aging. We have stretch marks, we have loose skin, we have bumps. If it can help with that, why not? To rejuvenate the skin cells.
It does. So it increases the water content in the skin. It makes the skin look fuller, and of course the color does of course change. So this is how the pack looks. So the pack has 2 phases. There's the phase that we have that's in the clinic, that has to be done by your gynecologist, and then there's the phase that is done at home by the patient. So we usually have a protective spray that we spray at first. No, that's a separate spray that we have. And then after the protective spray, we put the peeling solution, right? So this is kind of what it looks like.
And it's not a lot.
It's very little. It's very little. It doesn't need to be much because the area is also quite small. It's not too much skin. So there's a peeling solution. You can have a look at that. And then after the peeling solution, we have the actual mask. So we apply the actual mask. If you see, it's just like a brown colored paste.
It's closed, I know.
Yeah, it's sealed, so it's
brown
fine.
colored paste.
It's a brown colored paste which we apply with a brush on the external genitalia. And then after we apply that, we spray it with the neutralizing spray. So once that process happens, then we kind of just allow it to stay for a while and sit. It's usually, the entire process takes about 2.5 hours. And then after we apply the neutralizing spray, we usually put on a film. So we have the protective film which goes on now after the mask has been applied. So it's like a cellophane, and then that sits for 2 hours. And then we usually wash that off, and then we put something called a crystal fiber intimate mask. It's usually after the procedure. That stays on for a while as well. And then afterwards we give the patient this product to go use at home. So it's an intimate home depigmenting gel cream. And so they use this between 45 and 90 days. Usually the improvement in the skin in terms of the color is seen within 5 to 10 days, but this is what maintains it at home. So you're gonna use that for up to 3 months. Some patients prefer to use it longer than that, but this is usually issued on a month-to-month basis, because monthly we do reviews just to see, are you getting any allergies? Is there any problem? Is your skin lightening to your satisfaction? And so on and so forth. So that's the process.
I suggest use it for 3 months, because then again, you don't want down there to be lighter than up. You're just trying to find a tone that matches the rest of your body. Yeah, and I also feel like for this one, and I'm not a doctor, again, it's all about being realistic. It depends on how dark you are. So let's say if you moved from very dark and you're number 1 or 2. I always feel like with aesthetic procedures, it's good to be realistic. Yeah, because I've done a few of them, and so it's good to be realistic. So wow, this is interesting, guys. I am doing it. I can't show you the before and after, but I'll tell you if it worked. I'm doing it.
We can show some of the manufacturers before and after.
Yeah, we will show on this video. We'll show you the before and after, people. It's nothing sexual, just to show you the results.
So that's the product. And so as I said, within 5 to 10 days you should be able to see effects. And they're usually quite dramatic, with very minimal adverse effects. Like you could get, of course, there's nothing that doesn't have adverse effects. You could get an allergic skin reaction, but it usually resolves on its own very quickly and doesn't cause much problems after that.
And what I like about it is that it's dermatologically tested, because even if it's your reproductive area, it's not external reproductive, or not internal, it's still sensitive skin. And what I like about it is, why I've been afraid to use anything I've seen in the market, is because I don't trust, I'd be doing more harm than good, because there's no expertise, it's not a doctor or a specialist. This thing of telling each other to go apply this, I might be doing more damage than I'm doing good. And also you're afraid it's externally, yes, but what if it's not safe and then affects internally? There are many chemicals out there. So I think I'm happy this is a safe product. I'll be using it. So would you like to tell us, like, what's the cost of the whole package, meaning you doing this and then the 3 months of, so they will have to buy this again twice?
They'll have to buy the at home cream.
2 months, because you give them for the first month.
This sometimes, depending on how people are using this, sometimes can be enough for a month or slightly longer.
I know how I'll be using it.
So yeah, it kind of depends. The entire process, and even the manufacturer recommends that the phase 1 must be done by a medical professional in a clinic, and then you go and continue phase 2. So many people are tempted to buy it, to do it for themselves at home. I'm just warning against that.
Why do we like shortcut people? It's a very intimate area of your body. Please, let's not we don't do shortcuts with our hair, with our skin, with our nails. Why don't we also take good care? I always feel like, why would I go to do surgery in a place if I can do it with the right doctor. So if you love yourself, please let's do it the right way.
Yeah. So the entire procedure costs 60,000. And then now, of course, there's the at-home cream. It's not too expensive. I don't recall the exact cost of the at-home cream, but the procedure is 60,000, and that should be able to take you about 45 days into the entire process. So if you're buying the at-home gel, you'll buy probably at most 2 more tubes.
Yeah, so I'd say approximately 70,000, which the doctor will see your progress, visit the doctor. In case of any reaction, the doctor will advise you. So I don't think it's so bad. For a problem that I've had for years, people, I think I can save my coins and come.
Yeah. There's other products as well for skin lightening, but this is the one that I use at my clinic.
Yeah, it has shown good results so far.
It has, yes.
Okay, people, so solution for our intimate skin, like hyperpigmentation. So our next topic is vaginal Botox. I found that very interesting. I know that you can use Botox on your face to reduce wrinkles, to tighten your skin. But there's also vaginal Botox, and I'd like the doctor to talk about it because people go for vaginal Botox for a medical reason. So maybe explain to us a bit.
Yeah.
Why would you need vaginal Botox?
So you would need vaginal Botox because you have a condition called vaginismus. Vaginismus, yeah. And vaginismus is a condition where the muscles of the vagina contract involuntarily. And so they make it very painful to have sexual intercourse, or sometimes even to do some simple things such as inserting a tampon. So most of the time at the entry to the vagina, there's a lot of pain because the muscles have just contracted and spasmed involuntarily. The patient is not able to control that contraction, and so it causes painful sexual intercourse. But of course, there are very many reasons to painful sexual intercourse. It could be some medication you're taking, it could be hormonal, it could be endometriosis, of course, it could be a vaginal infection, it could be a skin infection. There are many reasons. There's so many reasons. So you need your gynecologist to be able to diagnose that actually this is vaginismus, and vaginismus can be either primary or secondary. And primary means that this is the first time you're having sexual intercourse, and penetration is almost impossible, and many patients describe it as if their partner is hitting a wall. That's actually a typical description for the patient. So and what happens is that it's the first time. Sometimes they're able to eventually get penetration, but it's a very painful process. And then we have secondary vaginismus. So secondary vaginismus is where a patient was previously able to have sexual intercourse without pain, and then all of a sudden this involuntary muscle spasms start. It could be sometimes due to a traumatic experience, either a physical traumatic experience or an emotional traumatic experience. But at the end of the day, the muscles are contracting involuntarily and they cannot stop. And so then that's where the Botox comes in to treat this condition.
Wow. So ladies, I've also learned, I didn't know there's a condition like that, and that's why I always say live and learn. You can learn from anyone, anywhere. So we're not talking about the usual first time pain when you have sex. That's different because there's penetration but you have pain, but this is where you're not able to penetrate and it's so painful, like you said, hitting a wall. So I just say, a lady who's outside there and has been experiencing this, I hope you watch this and I hope you seek help and you also don't feel like something is wrong with you, you know. So Dachari will tell us why they use Botox, or why Botox is a preferred treatment for this kind of condition.
Yeah. So Botox is actually a generic name. It's like what the company calls it, but it's a neurotoxin. It's called botulinum neurotoxin A. And so the neurotoxin is what we inject. So what happens is that you go to your gynecologist, they diagnose that it's actually vaginismus and not any other cause of painful sexual intercourse. And then they identify the exact group of muscles that are contracting involuntarily. So usually it's a group called bulbocavernosus or bulbospongiosus.
We are lost.
They're just a group of special muscles, and then so your gynecologist identifies like these are the ones that are contracting involuntarily, and then they inject that particular muscle with the Botox. And what it does is that it paralyzes that muscle, and once the muscle is paralyzed, it stops contracting. So the procedure is 90 to 97% effective.
Wow.
It's a one-time injection.
A one-time
injection
again
for painless penetration. Most patients, over 90% of patients, are actually cured if the diagnosis is correct.
Amazing. So people out there, guys, 1 hour of your life, and we can be back to enjoying ourselves.
Yes.
But it's very interesting, and I don't know if maybe because there's no one to speak about it. I know there are many silent sufferers, many people who are struggling with such kind of a condition. But like Dr. said, don't Google it. If you suspect that you have something and you're struggling, please seek medical attention from an expert, and then you get medical diagnosis. Because again, then otherwise you'd be putting Botox the wrong place.
Yeah.
Is it the same, Dr. My question, for example, as a woman, ages come, whatever, our skin ages differently. You might find someone who's 35 has a more thicker, fuller skin compared to someone who is maybe 25. So that sometimes you find, like, I don't know if it's called vaginal area. It's called vaginal area, or I don't know what to call it. I'm not an expert with the words. Or your lips are not so full and they are flappy and flabby. Do you use Botox, or what do you use?
So aesthetically, once the labias become saggy or less full, we can use fillers. Aesthetically, we can use fillers. We can use either synthetic fillers, but the best is actually using fat from the patient. So there's a procedure called autologous fat graft, where we do a small liposuction on the tummy and then we re-inject into the vulva. But that usually won't cause you pain, that kind of condition. Vaginismus is specifically a
very
muscle.
painful.
A muscle.
For that is just aesthetically,
Yes,
because I know that not many people have. I have that question because it's a concern I have as I'm aging. If that ever happens,
Yeah. What do I do?
You see, so it's a question I would ask, but this is free consultation even for you guys. It's always good to be aware of these things. Whatever you can fix. But I'm very, very happy about that vaginismus and
vaginismus can be treated.
How many? What's the percentage of women who might come across it in their lifetime?
It's difficult for me to tell, and the funny thing is that with Africa we rarely have studies about such things, because previously there were very many therapies that were available. So you could have something called a hymenectomy, where you'd go to a doctor and they'd cut your hymen open so that they think maybe the problem is within the hymen. Some women were told to do Kegels. Some women were given anti-anxiety medication, antidepressants.
And kumbe it's the muscles which are contracting
it's just the muscles. Yeah. So the studies are very few. Even in the West, the studies are few. In Africa, they are even fewer. In fact, I'd say probably non-existent. Because even if it's been studied, it's probably not been published. So I'm not able to give you exact figures. But I think the really important thing is that patients who have vaginismus, they never actually fully have sex initially. So even once the injection is done, there's a process called serial dilatation. So we give them something called vaginal dilators that help the vagina to expand a little bit every day until they transition into actual sexual intercourse. So that's really important to note. But as much as we don't exactly know how many women are affected by this, the response rate is so fantastic that it's definitely something that's worth having. You can imagine if 97% of women who have that are actually able to be treated to complete resolution. This is something that is probably not going to happen again, because once the muscles are paralyzed, some women do need a top-up, but it's very rare. It's a one-time thing. So
I feel like it was a very good point to note that as a woman, you don't tend to feel it's my fault and there's a problem with me, or I'm too tight. These myths that we keep telling ourselves. Am I the only one who maybe has a small, I don't want to call it a hole, but a small entry point? I don't know. What is the word?
Vagina. It's called an introitus, the entry. The introitus,
people, let me tell you, biology in high school was the most this was the most difficult. I think I blocked my mind, that's why I don't know the names, because of how our female reproductive is it organ or health, or that area, we never talk too much about it. So I find such conditions can break relationship, marriages, and even just your self-esteem. So Dashari has a solution, and he's talked about it today. So vaginal Botox, guys, is not for aesthetics. It's actually for treating a condition known as
vaginismus,
guys. Vaginismus. So Dashari, before we finish, I just want to ask, like any client who walks through your door, is there any side effects of the Botox?
So yes, there are a few side effects. They're very rare, but there have been some documented. There's a side effect that resembles a condition called botulism, where you'll get like blood vision. That's one of the symptoms of the botulism-like effect. A few patients in some studies have reported urinary incontinence. Some have reported vaginal dryness afterwards because there's a way the nervous system is connected that it can affect the lubrication of the vagina. But those are very rare side effects, and as I mentioned, the success rate for this procedure is very high, and the safety profile for Botox is high.
Okay, so it's always good to know the side effects, but I think here the good outweighs the bad clearly. If I wasn't able to have penetration, and finally I can have penetration without pain, and I can enjoy that sexual intercourse with my partner, why not? And the good thing is, because you're seeing a professional, in case of any of those side effects, they know how to deal with it. But as you've heard, sorry guys, the rain, I'm trying to speak very loudly. I also tell Dr. Christine to speak loudly. Sorry, there's rain, but I hope you can hear me. It's being done by a specialist, so that's why I always say seek professional help. In case of any side effect, they will know how to handle it, and they've done this before. Again, like I said, side effects are normal for any procedure in life. Try it. But the good thing here is that you're doing it with a professional, you're doing it with an expert. In case anything happens, then they'll know what to do and how to handle it. Another question is for the intimate skin lightening, how long do you have to wait until you can have sexual intercourse? I know most people outside there will ask.
So you need to wait at least 5 days before you can have sexual intercourse. 5 days.
5 days. So let your partner know that.
Yes. And because the effects are seen between 5 to 10 days, if you're doing it for a special occasion like a wedding, I'd advise you do it 2 weeks in advance. And then for the gel cream that you use at home, it's usually advisable that you use it after showering, just before you sleep. And in terms of sexual intercourse, it's not going to affect your partner.
Yeah, so in case even a little bit goes in there, it's not going to burn him. You know how we have mates, and yeah, those are questions you can ask. I think it's a very good package for bridal brides. I think, why not, if your first night, I mean, I'm not saying you're a virgin, but I'm just saying, okay, you see how we are going to talk about these things. So I just think, if I was a bride and there was something like this, I wouldn't mind trying it. It's a good nice present, even for a bride. I think it's something we should consider. It's a nice gift. So like the time you said, if it's for a wedding, I think 14 days would be nice, because you give yourself 5 days in case of anything. Yeah. So Dr. does the products or this, does it have anything carcinogenic or anything that can affect you? Just to be clear, because those are the questions I'm thinking I'd ask when I come to your office, especially someone who's very informed. Yeah, so it's actually a very good question, and it's something that people should ask themselves before they apply or do anything to themselves. But no, it has no carcinogenic products, it has no steroids, because steroids are generally known to lighten skin. And yes, especially steroid creams, they're known to lighten skin. This has no steroid, it has no hydroxyquinone, it has no harmful substances, it has a very, very high safety profile, so none of those dangerous substances. Okay, good. It's good to know. Also, where is the product manufactured from? Like, again, can I walk in and buy from a pharmacy? You said no. I just emphasize that, because ladies, let's not harm ourselves or do it yourself, because I'm sure there are procedures that the doctor is trained on that I don't know. Yeah.
So it's a Spanish product. Unfortunately, you cannot buy it over the counter. It's sold directly to medical professionals. It is not a spa treatment. It has quite a high retail price in some countries. In some, it's a little bit better. It's approved by European dermatological societies for use by a medical professional. So it must be done by a doctor. A medical
professional. Yeah. And I think, to be honest, 70,000 for something that will boost your confidence, ensure that your skin tone matches. For people who are concerned, people like me, obviously I want to match everywhere, but as you can see, it doesn't always happen. So the Sharia said it's not for here, so I think for here it might choose something else. I'll give you an update on this one. It really bothers me. I think because we had the Mbao desk, was it desk or what they call it?
Desks.
This was in class 4. Class 1 to 3 we had benches. Remember, come let's benches. My time was benches.
Yeah, it's
so
like
sit
4
for
kids.
view. Form 4 was up. Class 4 was upgrade. Now you have your own desk and chair. So that, like the chair said, this is just for your intimate area. Yeah, I think that's it, guys. But basically, please just go to a medical practitioner. Ensure that it's done by a medical practitioner. So guys, let me know if you have any questions. We can do an IG live with Daktari if you have questions that we need to answer. And as always, Daktari, it was nice having you.
Thank you so much.
I've learned a lot. I think during this COVID has been a year of women reproductive health.
I'm learning.
I've learned a lot, Daktari. Thank you very much.
Thank you.
And again, her clinic is Alora Medical Center, 40s.
Yes, 40 Suites, 6th
I've been
floor,
there 3
room
times and I get knocks. I don't know why I got Fifth Avenue. So 40
Suites, 6th floor, room 601, Alora Medical Practice. And
you guys, it's a beautiful place. I always go there and have ginger biscuits and tea. Yeah, so ladies, until next time, thank you and bye-bye.
Bye.